Imagine working as a paramedic and you're called to respond to a 911 emergency where a person was found in the middle of a public square and is unresponsive. It is now your job to try to figure out what is wrong with the patient and how to treat and transport that patient. So you show up and you see the following scene to the left of the slide with several people all standing around them. And you think, what do I do? What do I say? I myself have been in this situation many times in my life. Almost 20 years ago, I started my career as a medic in the military. And I can't tell you how often I responded to these calls where I wasn't sure what to say or what to do. Over the years, I became interested in how we teach paramedics to communicate and respond to emergencies and effectively assess, treat, and transport patients. And I started to notice that there were differences in how we teach paramedics to communicate in the classroom and how they actually communicate when they're out on the road. My research explores how paramedics communicate in both training and the workplace. To understand this field, I analyze video recordings to study how paramedic students treat simulated patients, and I analyze the documents that outline the rules and procedures that guide paramedics and how they should assess, treat, and transport patients. I'm interviewing instructors, paramedics, and students to understand how they communicate and to figure out what is wrong with the patient and how to treat them. You see, to the right of the slide, the paramedic is interacting directly with a simulated patient. Their partner is just standing off to the side, waiting passively to be told what to do. But this isn't necessarily what happens in the workplace. Oftentimes, paramedic partner would start to work on other tasks right away, like taking a blood pressure or collecting a list of medications from a family member. In my research so far, I found differences in how working paramedics and students use the tools of their trade, like reference documents, differences in how paramedics work with other first responders, and differences in the guidelines that paramedics follow compared to those that students follow. Each of these differences appear to influence how paramedics communicate in the classroom and the workplace. By understanding how paramedics communicate in training and on the road, I believe that these findings may help paramedics learn how to communicate and collaborate to better assess, treat, and transport patients to get the help that they need. Thank you.